de Presse. I'm Elizabeth Thompson with CBC News. With us today, we have Dr. Theresa Tam and Dr. Howard New from the Public Health Agency of Canada, who will give us their weekly briefing on COVID-19. Aujourd'hui, on a Dr. Theresa Tam.
We have Dr. Theresa Tam and Dr. Howard New from Public Health Agency of Canada, and they will provide information on COVID-19.
Thank you very much, and bonjour à toutes et à tous. COVID-19 disease activity indicators, including weekly case counts, have been declining for the past few weeks, and many of the areas of the country appear to be at or past the peak of their current wave activity. However, some regional variability in disease and severity trends is being observed, including in wastewater signals and hospitalization numbers. Similar to previous waves, lagging severity indicators are slower to decline, but are expected to stabilize and decline following infection rates. As the SARS-CoV-2 virus continues to circulate worldwide, we must prepare for renewed activity and potential new variants of the virus in the months ahead. In particular, as part of readying ourselves for the fall, with more people returning to in-person work and children going back to work, getting vaccinations up to date is a top priority. This applies for COVID-19 as well as for other vaccine-preventable diseases, given outbreaks and circulation of measles, polio, and meningococcal disease in other countries. In the almost 2 years since COVID-19 vaccines first became available, Health Canada, the Public Health Agency of Canada, and the National Advisory Committee on Immunization have been closely monitoring vaccine safety. With more than 87 million doses administered in Canada and billions worldwide, COVID-19 vaccines have been shown to have very good safety profiles. Evidence continues to demonstrate that the benefits of COVID-19 vaccines outweigh any risks across all age groups. Vaccine effectiveness data show that COVID-19 vaccines provide strong protection against the most severe outcomes of the disease, including reducing the risk of hospitalization and death due to COVID-19. Although protection from vaccines and from previous infection decreases over time, particularly against Omicron variants, we know that COVID-19 booster doses are effective in activating our immune response to improve protection against severe outcomes up to 90%. Today, Health Canada authorized the 10 microgram Pfizer BioNTech Comirnaty COVID-19 vaccine for use as a booster dose in children aged 5 to 11 years, and NACI released a national guidance for its use in Canada. This booster dose provides a great option to restore protection for this age group, especially for those who are at high risk of severe illness. Specifically, NACI recommends that children 5 to 11 years of age who have an underlying medical condition that places them at high risk of severe illness due to COVID-19, including children who are immunocompromised, should be offered a first booster dose of the 10 microgram Pfizer BioNTech Comirnaty COVID-19 vaccine at least 6 months after completion of a primary series. For all other children in this age group, NACI recommends the 10 microgram Comirnaty vaccine may be offered as a first booster at least 6 months after completion of a primary series in the context of heightened epidemiological risk. Although there remains much to be learned about post-COVID-19 condition, also known as PCC or long COVID, several studies have now shown that COVID-19 vaccination reduces the risk of developing PCC if a person who is vaccinated with 2 or more doses later becomes infected. Ongoing research will help strengthen the evidence on this important issue. COVID-19 prevention strategies, including maintaining up-to-date vaccination, remains the foundation of our protection individually and collectively. While less than half of 5 to 11-year-olds have completed their primary series of vaccines, NACI continues to strongly recommend a primary series with an authorized mRNA COVID-19 vaccine as a top priority. Although the timing and severity of future waves is uncertain, NACI recommends a full boost dose should be offered to eligible people at increased risk of severe COVID-19 illness and may be offered to all other eligible people, regardless of the number of booster doses previously received. Many of the good personal protective habits we have honed over more than 2 years of managing COVID-19 can also reduce your risk of getting infected and spreading other diseases, including monkeypox and influenza. Keeping up with hand washing, wearing masks in poorly ventilated spaces, and staying home if you have symptoms. As we make plans for the fall, it is good time to stock up on good quality face masks and rapid tests, as well as to book an appointment to check indoor ventilation or HVAC systems to optimize clean airflow. While remaining vigilant for COVID-19, we are also closely monitoring the monkeypox situation in Canada and internationally. As of August the 19th, a total of 1,168 confirmed cases of monkeypox, including 30 hospitalizations, have been reported nationally, with New Brunswick reporting its first confirmed case this week. Nationally, there has been a slowing trend in the increase in new cases reported in recent weeks. Over 99% of reported cases are male, and the median age was 36 years. Among confirmed cases for whom additional information is available, the majority reported intimate sexual contact with other men. To date, the Public Health Agency of Canada has distributed over 105,000 doses of Immunization vaccine to provinces and territories, with over 59,000 people vaccinated with at least one dose as of August the 14th. At this time, to lower the overall risk of getting infected and spreading the monkeypox virus, the Public Health Agency of Canada recommends practicing safer sex, having fewer sexual partners, particularly anonymous partners, even when they don't have symptoms, can also reduce your risk of getting infected. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello,
Les
everyone.
indicateurs d'activité de la COVID-19,
COVID-19 disease activity indicators, including weekly case counts, have been declining for the past few weeks, and many areas of the country appear to be at or past the peak of their current wave activity. However, some regional variability in disease and severity trends is being observed, including in wastewater signals and hospitalization numbers. Similar to previous waves, lagging severity indicators are slower to decline, but are expected to stabilize and decline following infection rates. As the SARS-CoV-2 virus continues to circulate worldwide, we must prepare for renewed activity and potential new variants of the virus in the months ahead. In particular, as part of readying ourselves for the fall, with more people returning to in-person work and children going back to school, getting vaccinations up to date is a top priority. This applies for COVID-19 as well as for other vaccine-preventable diseases, given outbreaks and circulation of measles, polio, and meningococcal disease in other countries. In the almost 2 years since COVID-19 vaccines first became available, Health Canada, the Public Health Agency of Canada, and the National Advisory Committee on Immunization, or NACI, have been closely monitoring vaccine safety. With more than 87 million doses administered in Canada and billions worldwide, COVID-19 vaccines have been shown to have very good safety profiles. Evidence continues to demonstrate that the benefits of COVID-19 vaccines outweigh any risks, and this applies to all age groups. Vaccine effectiveness data show that COVID-19 vaccines provide strong protection against the most severe outcomes of the disease, including reducing the risk of hospitalization and death due to COVID-19. Although protection from vaccines and from previous infection decrease over time, particularly against Omicron variants, we know that COVID-19 booster doses are effective in activating our immune response to improve protection against severe outcomes up to 90%. Today, Health Canada authorized the 10 microgram Pfizer-BioNTech Comirnaty COVID-19 vaccine for use as a booster dose in children aged 5 to 11 years, and NACI released national guidance for its use in Canada. This booster dose provides a great option to restore protection for this age group, especially for those who are at high risk of severe illness. Specifically, NACI recommends the following. Children 5 to 11 years of age who have an underlying medical condition that places them at high risk of severe illness due to COVID-19, including children who are immunocompromised, should be offered a first booster dose of the 10 microgram Pfizer-BioNTech Comirnaty COVID-19 vaccine at least 6 months after completion of a primary series. For all other children in this age group, NACI recommends that the 10 microgram Comirnaty vaccine may be offered as a first booster at least 6 months after completion of a primary series in the context of heightened epidemiological risk. Although there remains much to be learned about post-COVID-19 condition, also known as PCC or long COVID, several studies have now shown that COVID-19 vaccination reduces the risk of developing PCC if a person who's vaccinated with 2 or more doses later becomes infected. Ongoing research will also help strengthen the evidence on this important issue. COVID-19 prevention strategies, including maintaining up-to-date vaccination, remain the foundation of our protection individually and collectively. While less than half of 5 to 11-year-olds have completed their primary series of COVID-19 vaccines, NACI continues to strongly recommend a primary series with an authorized mRNA COVID-19 vaccine as a top priority. Although the timing and severity of a future wave is uncertain, NACI recommends that a fall booster dose should be offered to eligible people at increased risk of severe COVID-19 illness and may be offered to all other eligible people, regardless of the number of booster doses previously received. Many of the good personal protective habits we have honed over more than 2 years of managing COVID-19 can also reduce your risk of getting infected and spreading other diseases, including monkeypox and influenza. Keep up with hand washing, wearing masks in poorly ventilated places, and staying home if you have symptoms. As we make plans for the fall, it is a good time to stock up on good quality face masks and rapid tests, as well as to book an appointment to check indoor ventilation or HVAC systems to optimize clean airflow. While remaining vigilant for COVID-19, we are also closely monitoring the monkeypox situation in Canada and internationally. As of August 19th, a total of 1,168 confirmed cases of monkeypox, including 30 hospitalizations, have been reported nationally, with New Brunswick reporting its first confirmed case this week. Nationally, there has been a slowing trend in the increase in new cases reported in recent weeks. Over 99% of reported cases are male, and the median age was 36 years. Among cases, confirmed cases for whom additional information is available, the majority reported intimate sexual contact with other men. To date, the Public Health Agency of Canada has distributed over 105,000 doses of Immunization vaccine to provinces and territories with over 59,000 people vaccinated with at least one dose as of August 14th. At this time, to lower the overall risk of getting infected and spreading the monkeypox virus, the Public Health Agency of Canada recommends practicing safer sex. Having fewer sexual partners, particularly anonymous partners, even when they do not have symptoms, can also reduce your risk of getting infected. Thank you.
Thank you very much. We will now go to questions. On va passer aux questions.
We will now go to questions. If you have a question, please use the raise hand function.
The raised hand function. It'll be one question, one follow-up. And the first question goes to Dylan Robertson from the Winnipeg Free Press.
Hi, Dr. Tam. Some provinces have had monkeypox cases for a while now, but other ones are just having their first cases. We know the knowledge of this virus has evolved over time, so what advice could you give to the government and to the citizens of a province that have just learned about their first case of monkeypox? Do we have any sort of lessons learned so far?
Yes, hello, Dylan. Thank you for that question. And yes, we have been learning quite a bit more about this virus over the past several months. So as I've said in my opening remarks, certainly in the initial provinces who've had cases, it seems that there's we're beginning to see a slowing trend in the trajectory of the epidemic curve. And so we are watching that very closely. We know that the vast majority, 99% of reported cases, are males who are around the age of 36 as a median. So, and the majority report intimate sexual contact with other men. So it is very important to support community organizations and people who have the trust and work with this group, because they are at the highest risk of infection right now. And we have been distributing vaccines to all provinces and territories. So there is consensus amongst the chief medical officers that we should be providing a targeted approach to vaccinations at the moment to groups at the highest risk of exposure. So I think I will encourage the sharing of this information widely within jurisdictions that haven't had any cases, so that people can take the necessary precautions. And of course, we know that by reducing the number of contacts, including sexual contacts, anonymous contacts, intimate contacts in general, you can reduce your risk. So I think given those facts, I think we can make sure that the cases don't increase rapidly in the other jurisdictions.
Thank you. And also for Dr. Tam, I'm just wondering if you have any modeling that might suggest how many undiagnosed cases of monkeypox are circulating, or perhaps the national are not. And if you don't have these, if you could just clarify whether this might be coming at a later briefing, or if this is not the amount of detail that FAC is tabulating right now.
Yes, we don't have sufficient data to do forecasting, for example, but we have been looking at different scenarios using different R-naughts, for example. And what we found was if we had uncontrolled spread, our trajectory would be worse than where we are now. And if we're following all those different curves, we are seeing that in Quebec and also in Ontario, there beginning to be some slowing down of the trajectory, which is good news. But we need to keep going. And so I think that's where we're at right now. So it's based on looking at those scenarios. And I think internationally, what we're finding is, of course, the risk is high amongst the group of gay, bisexual, and men with men in terms of acquisition and transmission, but the R rating is very, very different outside of this group. So, and I think the estimates are still above 1, but somewhere between 1 and 2.
Thank you. Next question goes to Nujud Almalis from Canadian Press.
Hi, yeah. My first question is about today's announcement about boosters for 5 to 11-year-olds. Your language, you say that for those who are at high risk should get the booster, whereas you say for all other children that they may get a booster. Can you talk a little bit about the distinction in that kind of language and why?
Yes, and this is language that NACI often uses, and they can change over time with the gathering of more information as well. So, of course, children with underlying medical conditions at the highest risk of severe outcomes. And if you're looking at the benefit risk analysis, NACI, based on current information, indicates that they should be offered. They're at the highest risk of severe outcomes. And for all other children, the risk of severe outcomes are generally rare. But I'm a pediatrician. I like to remind parents that severe medical conditions in this age group should be rare. But this is preventable if you get vaccinated. So I think giving people the choice and providing parents and kids with information about the effectiveness of vaccine and the importance of the booster can help them make this choice.
Thank you. And my second question is about what we're hearing about a potential bivalent vaccine and its potential rollout in the fall for parents who are people, sorry, for just people who are watching this. Do you recommend that they hold off on getting a booster until that rolls out, or should they get a booster now? What are your recommendations, especially in the context of whether the bivalent vaccine would be more effective against new variants?
So that's a very topical question, I think. And first of all, I know that our regulatory colleagues in Health Canada are working very fast at reviewing the submissions from Moderna and from Pfizer-BioNTech on the bivalent booster doses, meaning by bivalent, we mean the original strain as well as the BA.1 strain. That's the information being submitted at this point. And I know work is going on as fast as possible. And we also have secured sufficient supply of the bivalent formulation should the regulatory authorities go on to authorize the vaccines. And I think that individuals should know that when we look at the vaccine effectiveness of that booster dose in the age of Omicron, it does restore your protection, and particularly against severe outcomes. So even though the ancestral strain the current strain doesn't only contains the ancestral strain, it's still able to boost. What we're looking at is whether the bivalent vaccine would have an added benefit. And so that is currently being reviewed. I think it depends on your own set of circumstances and the epidemiologic situation. Those who prefer to wait for the availability of the bivalent doses should also consider their risk factors for exposure and the potential for severe outcomes. Because it's actually really important not to miss the chance of getting your booster if it's been 6 months since your last infection or last vaccination. Because if you waited too long, the wave could be starting and you then don't derive as much benefit. But that's what I would suggest, to look at your own set of circumstances.
Thank you. The next question goes to Karen McKinley from the Brandon Sun.
Good morning, everyone. Thank you for taking the time. Just on that for boosters in COVID-19, you said that data is showing most jurisdictions in this country seem to be past the summer wave peak. That being said, considering the aggressive vaccine campaigns we've had over the last 2 years and going into the fall, which traditionally we've seen has been meant more infections and another wave. Do you have any kind of concerns or predictions for if there's going to be another wave and what it may look like?
Yes, so the summer months tend to be the months where transmission of respiratory viruses comes down. But even in the summer month, we got this BA.5 wave. And the impact of the BA.5 wave is not inconsequential and has, like in the other waves, resulted in quite a large number of hospitalizations and indeed, tragically, deaths, particularly in the elderly. When we come to the fall, it is very likely that the transmission would increase as people go inside. And we want people to get back to normal lives and be able to go to school, go to colleges, get back to work. So under those circumstances, we really do need to layer on the protections. It's possible, although we don't know yet, it's possible that you would get a bigger wave in the fall compared to the summer. But we definitely have to plan for it, even though we can't absolutely project it at this time. It's just that's how respiratory viruses behave in general. So I think we should plan ahead for a bigger fall wave. And therefore, the provinces and territories, working with the federal government, you're going to see a rapid escalation of campaigns ahead of the fall, so that people are supported in getting access to the booster doses, as well as being provided the information as to why it's important.
Okay, thank you for that. And just the follow-up leads into that because Manitoba has announced a while ago they were holding off on their full vaccine campaign and for boosters until the bivalent becomes available. Just wondering your thoughts on that, and also, again, I know you've said that you're looking into the bivalent, but does this mean that maybe it might be a better option and people should perhaps consider it over a traditional booster?
Yes, and I think I've mentioned also depends on your risk factors and the epidemiology in the local jurisdiction. But for the 80 plus age group, and this is what Quebec is doing, for example, is or the long-term care facilities, that if it's been over 6 months or 5 to 6 months, they're thinking, well, we can't wait because the full escalation could be upon us. And this is the group that can't really wait. But for other groups, first of all, if you haven't actually got your primary dose, that this will be an important time. But for the younger age groups, depending on your risk factors, you could consider waiting for the bivalent dose, which is to come. We don't know the exact incremental benefits, but we do know that Omicron is a very different looking virus with a spike protein that's very different, and the new vaccine will contain that particular variant. So I think, as I said, if you're going to wait, think about your risk factors and your potential exposure wherever you're heading indoors, and take that decision accordingly. But I think, as I said, the provinces will provide more information, I think, in the days to come, because, of course, we're now in the middle of August.
Merci. Prochaine question, Olivier Perron.
Next question, Olivier Perron-Boisé, TVA.
Oui, bonjour. Merci de prendre nos questions. Peut-être une
Question.
première pour
Thank you for
Dr.
taking the
New.
question. This
J'aimerais
question
simplement
will be for
savoir,
Dr.
vous
New.
parliez davantage de l'importance
were
de la
talking
dose de rappel pour les
about the
enfants que
importance
vous
of
qualifiez
booster
de
doses for
pas à risque.
children And you mentioned children who are not facing significant risk. Could that be the type of population for whom it might be advisable to wait for a new vaccine that would target the Omicron variant a bit more because it's a population that's not facing really high risk? Because many children have had COVID-19 already. So for this population, would it be better to wait for the new vaccine?
Oui, merci pour la question.
Answer. Thank you for the question.
Une question importante.
This is an important question indeed.
Oui, on dit que les risques pour les enfants en général, pour les
Risks for
conséquences
children
graves sont
and
pas
in
très
terms
grands,
of
mais
severe
on voit aussi
outcomes,
que même les enfants en bonne
for the most
santé
part, aren't very
qui ont
high,
eu la
and
COVID ont eu des
children in
conséquences
good
graves.
health who
J'ai
have
vu
had
des rapports avec
COVID-19
même des
in some
embolies pulmonaires, les
circumstances have
myocardites,
had pulmonary
des situations comme ça
embolisms,
qui sont évitables
myocarditis, and
avec
other preventable
évitables avec la
severe
vaccination.
conditions,
Donc, je pense que
preventable with
c'est très
vaccination, that
important de
is. So I
souligner
think it
pour
is very
tous
important
les
to
enfants d'avoir
underline
d'avoir
that
les séries primaires. Maintenant, si on parle
every
d'une
child
dose
gets
de
their primary
rappel,
series. When
oui,
it comes
c'est
to
aussi un peu
boosters,
comme Dr. Tam a dit
it
que
is
c'est une décision personnelle,
similar
peut-être
to
pour les
what
parents
Dr.
à
Tam
prendre pour leurs
mentioned.
enfants.
It is a
Je pense que
decision
si
for
un enfant
parents to
a
make for
peut-être
their
une
children.
affection sous-jacente,
If
peut-être
there's an underlying
immunodéprimée,
medical condition,
et
if
il y a
they're
beaucoup peut-être
immunosuppressed,
de
for
COVID-19
instance,
qui est en circulation dans la communauté. Je ne sais pas si c'est un risque
then in that case, I don't
on
know
veut
if
prendre
this
pour
is a risk
attendre
worth
un
taking,
vaccin qui n'est pas
waiting
disponible encore.
for a
Donc, je pense
vaccine
que
that is not yet
ça, c'est le cas.
available.
Mais
So
pour
I think
les
that
autres
is the
enfants, c'est
situation.
aussi
But for
une
other
décision
children, again,
personnelle.
it comes
Mais je
down to a
pense que
personal decision.
c'est une question de vraiment considérer tous les facteurs
So
peut-être
it's
pour
about
l'enfant.
considering all factors for the
Et
child in
aussi,
question or the
c'est
children
quoi
in
peut-être le
question.
seuil de tolérance parce que
And
on sait que peut-être même si les conséquences graves ne
we
sont pas
know
très
that
hauts,
even though severe
risque,
outcomes,
si
or the
ça
risk of
arrive
severe outcomes isn't very
une
high,
embolie
if
pulmonaire
it
ou quelque
happens,
chose
a pulmonary
qui est
embolism
vraiment
or
très rare,
something
mais si
else,
ça
which is
arrive pour
very
un
rare,
enfant,
but if it happens for a
évitable.
child, and this is something that's
C'est une raison
avoidable,
pour
well,
prendre
in that case,
le dose de rappel
that
qui est
might be
disponible
grounds for
actuellement.
going
Mais
for
c'est une
the
bonne
currently
question. Si
available
oui,
booster
je peux
doses. But
attendre,
it
on ne
is an
sait jamais
important
qu'est-ce qui va se
question.
passer avec
If you choose to wait, you
peut-être la
never know
vague ou
what will
qu'est-ce qui se
happen
passe
with
en
the
automne
next
ou
wave in
en
the
hiver.
fall
Et
or in winter.
si on attend pour un vaccin bivalent, oui,
If you
peut-être que
wait for a
ça va
bivalent
donner
vaccine,
une autre protection contre
it may
le
provide
variant Omicron.
an
Mais
incremental
on ne sait pas
protection
exactement la
against
date.
Omicron,
Donc,
but
je
we don't
pense
have a
que
firm
d'après
date
moi,
for that. So I
c'est une
think
décision personnelle
that it's a
et pour
personal
nous autres, c'est
decision,
sûrement une question de fournir
and
les
it's
bons
about
renseignements pour
providing the right
la
information
population générale,
for the general population
pour mieux aider à prendre une décision
to
éclairée
better
pour
help
leurs
them
enfants.
to make an enlightened decision for their
Merci. Puis
children.
peut-être
Thank you.
en sous-question, j'aimerais juste,
Question.
si vous
As
pouviez
a follow-up,
clarifier, parce qu'il y a quelques
to
semaines, le
clarify
ministre de la
things
Santé
for our
Mike Duclos
audience,
nous parlait d'une
maybe
vaccination à jour
a couple of weeks
à tous les
ago,
9 mois.
we were talking
Vous nous
about
parlez
up-to-date vaccination every
aux
9
6
months,
mois
but you're
après une
referring
dose,
to a period of 6
après la
months
dernière dose. Le Québec
following
également,
the
je pense que
last
c'était 5
dose.
mois
I
après
think
la
in
dernière
Quebec
dose. Donc,
it's
qu'est-ce
5
qui est
months.
réellement une vaccination
So
à jour
what
selon vous?
is up-to-date
9, 5,
vaccination?
6 mois?
Is it
Est-ce qu'on peut
9
avoir un
months,
peu
6
de
months,
clarté?
5 months? Can we clarify that a bit more?
Je pense que
Answer.
ça parle
Thank you.
d'une perspective technique
It
de la santé
is
publique
a
avec
technical
la science.
perspective
Je
adopted
pense que le
by
message est
public
simple. On
health
voit
based on
avec
the
toutes les données
science.
probantes à date,
When we
l'évidence
look at
scientifique que
the scientific
l'immunité
data that's
conférée par
available,
les vaccins
we see
commence à
that
diminuer et
immunity
c'est
provided by the
même le
vaccines
CCNE recommande
starts
une dose de
to
rappel 6 mois
diminish
après les dernières doses.
uh,
D'après moi, donc, ça, c'est la
after
chose
6
importante à
months
souligner.
following the last dose or the
N'importe quel
booster.
nombre
So
de
I think
doses
that's the point
après
to
la série
underline.
primaire, si on
So
a même
following
une
the
troisième,
primary
quatrième
series,
dose,
even if
si
you go for a
c'est
third or
déjà
fourth dose,
plus de 6 mois
if it
après
has been more
la
than
dernière
6
dose,
months
c'est une
since
bonne
the
idée de
last dose, then it's a
considérer
good idea to consider
d'avoir une dose de rappel. Donc,
getting
je
a
pense que
booster
juste au
dose. So I
futur, avec
think
les autres vaccins, peut-être on va trouver
maybe
une autre
with
raison, mais pour
other
l'instant,
vaccines in the future,
actuellement, je
we'll
pense
be
que
looking
le
at different
message clé,
periods,
c'est
different
si c'est
time
plus de
frames.
6 mois
But right
après les
now, the
dernières
message
doses
is if it's been
et
more
vous
than
êtes
6 months
admissible
since
pour
your last dose, and if
une
you're
dose de
eligible
rappel,
for a
vas-y,
booster,
allez-y.
then go for it.
Thank you. Y a-t-il d'autres questions?
Are there any other questions?
Going once, going twice. Karen, 1 second. Karen McKinley from the Brandon Sun again.
more of a scientific question. Just taking a look at how these outbreaks and all these viruses and diseases have been coming out. Of course, with monkeypox, it's adjacent to smallpox. And I'm just looking here on my news feed, and I see first case of polio in a decade has emerged in the United States. So just thinking, going forward, are we going to have to rethink how we consider certain diseases and viruses, quote unquote, eradicated or no longer a public threat if they keep popping up or mutating?
That is quite a big question. So I'll just answer the question about re-emerging vaccine preventable diseases. The vaccines against polio are very effective. The issue is under immunization. So I think for illnesses like measles, like polio, the key is to get up to date with your vaccination. I think the vaccine coverage is generally quite high for polio in Canada, but I don't know what happened during the pandemic. I hope people are getting caught up before school and before travel, etc. But that's really important. So that's that group of already vaccine preventable diseases. For emerging infectious disease, some of which and many of which come from animal to human transmission, we expect those might actually increase, given climate change and other factors and global travel. So we do need to prepare and do research and not ignore them. Monkeypox, as we know, has been knocking on our doors for quite some time and has now found a way of getting into the human population. Fortunately, vaccines have been researched, and we have some of that. Maybe not enough for the global needs, but at least all the research have been done prior. So what you need to do, I think, and there are many global collaborations that need more support, I think, to look at the risk. There are the sort of list of viruses that might become the next pandemic virus. And we need to think longer term and be able to support biomanufacturing infrastructures that can help us be prepared. It may not happen for a number of years, but one day it would arrive at our doorsteps, and you don't want to be in the same position again. So I think thinking that longer term, not ignoring signals when they keep knocking on our doors, is really important. And we've learned a number of lessons. In public health, I'm always worried that, yes, we've learned these lessons, but a few years later, this boom and bust phenomenon occurs where there's lots of attention paid to these infectious diseases now, and then people forget it in the intervening years, and then they're surprised that we actually might get another pandemic or another significant outbreak in our near future.
Thank you for that.
Karen, do you have a follow-up?
No, that was it for me. Thank you. Thanks for the answer.
Okay. Are there any other questions? Y a-t-il d'autres questions?
Are there any other questions?
One going once, going twice. There's Dylan. One second. Okay.
I always have questions.
Go ahead.
Thanks so much. I just wanted to know how you're feeling, Dr. Tam, about the rollout of the monkeypox vaccine. I realize your job is not to punch down on provinces, but just if you're seeing things that are encouraging you, if you think there's room for maneuvering to improve the rollout of these monkeypox vaccines.
Yes, thank you for the question. And I think we've had some really great collaboration with the province and territories, but even more importantly, collaboration from the community groups. So I think in general, the knowledge is getting out, but we can always do more. And that's why I think the federal government, for example, is supporting community groups. You've heard some of the funding announcements because we think that's going to be one of the most effective things. Of course, it's great for chief medical officers and provincial government officials and our teams to promote vaccination, but I think it's always really effective if we can engage the community. So I think that can always improve all the time. I learn about how to communicate on infectious diseases and vaccinations every day. And I learn mainly from the people with the lived and living experience. And so that's been really helpful. I do think that there's a fair enthusiasm to get the vaccine. So that's good. And the key question has been, from the province to us is whether we would have enough vaccine for pre-exposure prophylaxis for this high-risk group. And we do have the supplies, but we need to be good stewards of that supply. So we're monitoring that very closely and continue to do the science around the timing and the interval for a subsequent dose. And also, as I said last week, looking into dose sparing strategies, such as the one that the US is doing with the fractional dosing. So all of those are at play, but I think, as usual, is not a singular thing, but is a collaborative approach to getting the chains of transmission disrupted.
Thank you. And just in a similar vein, I just wanted to get your thoughts on where we're at in Canada with paid sick leave when it comes to COVID and monkeypox and everything else, because, in your annual reports, you've talked about how sick leave and these sort of policy interventions can help people actually quarantine when they need to. I don't suspect that you're getting labor data all the time, but I guess I'm just wondering if this is still a live conversation with the medical officers of health, or if we've sort of moved on from this, just given provinces peeling back these sorts of programs?
I think it is still a live discussion, particularly we're hearing from community groups who are saying that, some people really do need to be supported more to isolate if they have monkeypox. And so I do think as a broader policy conversation and decision, not just for the federal government, really all levels of government, and how we support people in their need to isolate, not just to get well, but also to protect transmission. And so I know that the federal government continues to support safe voluntary isolation sites for COVID-19. We still have, I was very happy to see social policies come into play when COVID-19 occurred. So I think we need to be able to leverage the success and lessons learned. It's very difficult to ask people to follow public health measures sometimes, particularly those in equity deserving groups. And that is actually one of the components of success, I think, in future pandemic response as well.
Thank you. Y a-t-il d'autres questions? Any other questions?
Are there any other questions?
Thank you very much for being here to answer our questions. This ends this press conference.